What difference do MS specialist nurses make for people living with MS? For non-specialist health professionals? For the NHS as a whole? Over 3 years, as part of our innovative GEMSS program, the MS Trust has worked with 15 MS specialist teams in England and Scotland who provide services for over 15,000 people living with MS. That represents nearly 15% of everyone with MS in the UK. The teams have been collecting data and gathering the views of service users to demonstrate the value and the impact of their services. This is what we found. People with MS rely on MS specialist nurses for continuing, coordinated, expert care. People with MS consult their MS specialist nurse more than any other health professional about their MS. We asked 1,254 people with MS which health professionals they had seen about their MS in the last 12 months. "73% of people with MS thought that having an MS specialist nurse had improved the overall coordination of their care. 47% of people diagnosed in the past year reported that their MS specialist nurse had helped them make an informed decision about disease-modifying drug treatment. We asked people with MS how their MS specialist nurse had helped them in the past year. MS specialist nurses increase the capacity of other staff and help non-specialists help people with MS. MS specialists save costs in the NHS. We asked 1,254 people with MS how they would have managed without their MS specialist nurse. Using conservative assumptions, GEMSS data suggests that each MS specialist nurse taking part in GEMSS saved £77.4 thousand in ambulatory care, that is, GP, A&E and neurologist attendance during the year. They also help prevent unplanned hospital admissions due to complications of MS, such as bladder problems or MS relapse. MS specialist nurses improve quality of life for people with MS and help them stay in work where possible. Read more about the findings of the MS Trust's GEMSS report. Visit mstrust.org.uk/GEMSS.